Thank you all so much for being here with us today. We are so excited for today's Mental Health 101 webinar. We know how important it is to learn more about children's mental health. And we are super excited to welcome Tiffany Krieger. Tiffany is a licensed school social worker and advanced mind-body medicine practitioner with over 15 years of experience working with clients from 3-year-olds to adults. She has experience working one-on-one, experience working in school settings. And so we're just so excited to have Tiffany here with us today. My name is Vicki Lehman, and I'm the Community Engagement Specialist at Childcare Answers. We are the local childcare resource and referral agency for Hamilton, Hendricks, and Marion counties. We work with families to help them find childcare, connect to resources. We work in the community. We do a lot of advocacy, educating, and then we also work with childcare providers. Thank you, Tiffany, for being here. We are so excited to have you, and I will hand things over to you.
Well, thank you, Vicki, and thank you to everyone for being here. I appreciate your time, and I am just so excited to be a part of this today. So let's get started. All right, we're doing Mental Health 101 today. We're going to talk about supportive strategies for all youth. And what I mean by that is these strategies can be used as preventative if we have youth who aren't showing any signs or having any difficulty at this time. These are still going to be incredibly supportive for their mental wellness in general, and they also can be used as intervention. And so if we do come across some of the youth either living in our homes or with whom we work who seem to be showing some signs of emotional struggle or emotional distress, these are going to work as interventions as well. So our goals for today is just to understand first the prevalence of mental illness in our society today with our young ones, and recognize some of the warning signs, see what we might look for and how we might identify some struggles, some emotional distress within our youth and even within ourselves. Honestly, we're going to talk about ourselves as well, because that is just as important. I want us to understand the importance of regulation, as I said, for the caregiver and for the child, right? A dysregulated adult can't help a dysregulated child or can't regulate a dysregulated child. So we're going to talk about how we care for both ourselves and the youth we serve. And then my hope is that we will spend a big amount of time on actual strategies so that you will leave here today with simple things that you can integrate into your work, into your home life, to support the kids in your life. We'll talk about that through psychological safety, creating connection, regulatory skills, and self-care. In keeping with our own mental wellness, I just want to remind everybody that we can't do the work we do if we aren't caring for ourselves, right? We know all the things. You can't pour from an empty cup. Self-care is what's going to support our community care. So if we are practicing these skills that we talk about today, we're going to be better able to serve those in our community, those in our home, and serve ourselves. And with that in mind, I like to start each session that I do with a nice calming centering breath. So if you would like to join me, I would love it. So I'll just invite you to go ahead and sit up straight. Place your feet flat on the ground if that's comfortable for you, if you're able. If you have something in your hand, you might put it down during this time. And if you feel comfortable to do so, go ahead and close your eyes or let your gaze fall to the ground. I want you to move your attention to your breath. And just begin breathing in through your nose and out through your mouth. Let those breaths get big and deep. You might even notice an audible sigh as you exhale, and that's okay. As you breathe in, notice your belly fill with air on the inhale. And become soft as you exhale. If thoughts arise, that's okay. Acknowledge them and just let them go without judgment. And just take a few minutes to continue these deep breaths on your own. And on your next inhale, breathe in all that you need to be present and at peace today. And as you exhale, let go of anything you're carrying in that might interfere with that peace. And as you're comfortable and it feels right, slowly open your eyes and rejoin us in that space. So hopefully taking that moment, I know it does for me, it always brings me to the room, to the space that I'm meant to be in. And I hope it was able to do that for you too. I know we have a lot going on in and out of our lives. If we can give ourselves the time during this hour, that can be incredibly important. So why are we here, right? Why are we talking about this? Why is it important? I'm sure we know, and we see it in our day-to-day life, but just some statistics for us to keep in mind. And I'll go through these quickly. 20% of people have a diagnosable mental illness. 50% of those with mental illness show the warning signs between ages of 8 and 14. So those of us, Vicki mentioned, I've done a lot of work in schools. That school age is the time where we're really starting to see those signs. And we're going to see them before too, when we have particularly youth who maybe have endured some trauma or some transition in their life that has been difficult. And the average length of time between the warning signs of a mental health need and that first intervention is 8 to 10 years, which is significant, right? Yeah, we have that delay in treatment, and that, as you can imagine, can be problematic. We want to intervene as early as possible. We're going to talk about how we can do that today. 67% of individuals have encountered adverse childhood experiences. If you've had the chance to learn about adverse childhood experiences and the negative impacts on adult health outcomes, this is pretty significant. And we are seeing a huge increase in anxiety and depression diagnoses in youth and adults. And this increase was occurring even before 2020, right? Even before the pandemic, even before lockdowns and e-learning and all of that. We've been seeing this increase. And at the same time, we're seeing a gap in services. Vicki and I were speaking about everything that we deal with in these fields prior to everybody hopping on today. And we were saying, you have specific agencies that you know where to send people for specific needs. And we might have those agencies on our list or on our contact list for mental health needs, but there's often a delay in even being able to get anybody in for that initial assessment. And, behavioral health is drowning a bit in some areas. So we want to be able to figure out how we can help preventatively and how we can help at home as we wait for services to kick in. When we're talking about our youth specifically, 9.4% of children between 2 and 17, you'll see that's over about 6.1 million children have received an ADHD diagnosis. We're going to see behavior problems being diagnosed. This can be through you might hear a number of terms like oppositional defiant disorder, conduct disorder. They might at times be referring to ADHD. And then we have the depression and anxiety. Pretty big numbers, right? For our little ones. Don't worry, it's not all bad news. We're going to get to good stuff. So I do want to kind of just look at this. The most common diagnoses, and that's what we're going to kind of talk about today for our youth, our depression, anxiety, and behavior disorders. And we saw that ADHD is in there as well, but this is the graph shared by, I want to say Mental Health Alliance, maybe. I'll find that. But look at that, even in the 3 to 5 years, look at that anxiety and behavior disorders, even in those early childhood years. And I've had the great privilege to work in preschools and to work with young children in foster care placement. And so a lot of the strategies that we're going to talk about are going to work for these kids as young as 3 to 5, and they're going to work for our 12 through 17-year-olds as well. So that's what's going to be exciting about what we're getting into today. But you see those numbers. And I can't talk about mental health and mental wellness, without talking about stress, right? We all have stress. Maybe we've had more stress in the past year and a half than we have prior to them. And we need to talk about that. We need to talk about what that's doing to our brains, what that is doing to our bodies, to our behaviors, and how that's impacting our kids. So stress is not always a bad thing. Stress can be really good. Positive stress happens. I don't know if any of you are procrastinators. I am. I don't love that about myself, but part of that productivity in those last minute moments before you finish something or have something due, that comes from an adrenaline rush. That's from stress, and that's positive stress, right? You have that brief increase, that elevation and adrenaline and hormone levels that get you going and get you motivated. And so you can push through that, you can get it done, and then it ends. And then your body returns to rest and digest, as they say. It returns to a calm state. And that's what we want. We want that kind of peak. You want that stress when you run into a bear in the woods. I'm sure we've heard this one over and over, right? If I run into a bear in the woods, I want my brain to react like that. I don't want to have to be up here in my prefrontal cortex processing what's happening. I want to have my stress response to give me a reaction that's going to keep me safe. And there's tolerable stress. So maybe, again, for example, going through this pandemic and going through all of the unrest that we've experienced collectively over the past year, we have stress that maybe doesn't leave. The stressor doesn't leave, right? It's ongoing. However, we have protective factors, and we're going to talk, that's part of the strategies we're going to talk about. We know how to recognize when we're in a stress state. We know how to calm our system, and we're able to do that even if the stressor doesn't leave. So it's tolerable. It's not harming us long-term. And then we have toxic stress, which is those stressors that are constantly going, and we don't have the tools, we don't have the skills to respond to them. Or maybe it's just so intense that our body has to stay in that state for survival. And that's when we're going to start to see some impact. I want to talk about that as well as our mental diagnoses, because it's all going to play into how we care for ourselves and how we protect each other. So let's just take a real quick moment to talk about the autonomic nervous system, or the stress response system. So let's say we do see a bear in the woods, right? You're on your little hike. You come across a very large bear in the woods. We know that our stress system is going to kick into gear. Our pupils are going to be enlarged so that we can focus in on the threat. We're recognizing that there's a threat. We are heart rate is going to increase. You might get sweaty. You might feel the blood drain from your extremities into your heart. So it's ready to pump, it's ready to move you, it's ready to get you out of there. Your immune system isn't going to be working as well. All those other systems are going to go offline momentarily to focus on helping you survive. And that's good in those moments so that we can react, we can respond, we can stay safe. And then when the threat is gone, when the bear has left, or when we have gotten to a safe space, the opposite starts to happen. So when we see the bear, it's kind of like in a car, it's like you hit the gas. Everything's going really fast and it gets you going. And then when the bear is gone, we hit the brakes and everything kind of starts to calm down. You feel the blood rush back into your hands, into your legs. Your heart rate starts to stabilize. You're able to see more of what's around you and not just be focused on the threat. And that's a very good thing. But you can imagine if you're stuck with your gas pedal on all the time in that fight or flight response, what could be happening to us, right? Especially when we talk about that increased heart rate. We talk about the immune system not working as well. We aren't going to be protected in other areas. And then we might be responding to things that aren't real or actual threats, but are perceived threats. We'll talk about that in just a minute. So what does that do? What does that do to our brain? What does it do to our body? When we live with the gas pedal on, so to speak, we're going to see, let's see if I can. You're going to see atrophy in your hippocampus and in your prefrontal cortex. So your prefrontal cortex is right here, and this is in charge of executive functioning. It's in charge of impulse control. This is when you are up here, you are ready to learn, you are ready to engage with the people around you, and that's your prefrontal cortex, right? And when you see that atrophy or get smaller, we aren't working or operating from this space. You're also seeing atrophy in the hippocampus, which is where memory is being stored, and memories are being created and saved. So you're seeing less of that as well, but you are seeing an increase in your amygdala, or your emotional reaction center. So you're going to see students who are living in this uncertainty and chronic stress reacting more emotionally. It can be as simple as I say, hey buddy, can you turn in your homework? And that just escalates behavior, and it doesn't make sense to me or you, because I feel like it was a pretty easy request, a pretty predictable request, but they're living in this state of heightened arousal and perceived threat all around them. And so there's going to be an emotional and possibly irritable reaction. So what happens? What do we see as kind of outward behaviors? We see increased anxiety, depression. We see digestive problems. And remember, this can be for our students, but it might ring true for some of us as well, if you notice any of these things in yourself at any time in your life. Headaches, and then that chronic stress can lead to heart disease, sleep problems. You can see an increase in autoimmune disorders, weight gain, and memory and concentration impairment. You don't want to stay in that state, right? But like I said, we're going to get to good news, I promise. I always feel like that at the beginning of this. I lay on all here's the tough stuff, but then we get to here's how we work through it. So when we're talking about potential behaviors of an unhealthy brain, so this could be a diagnosed mental illness, or it could be the onset of mental illness, or it could be chronic stress, it could be trauma. But let's talk about the behaviors of an unhealthy brain. So things to look for, things to know that we might need to start changing the way we're interacting with these kiddos. You're going to see a lack of impulse control. Anger and frustration are particularly prevalent with our littles. When you look at that 3 to 5, and across the board, when we look at signs, we know, right, that if we are talking about depression, you might see people feeling hopeless and feeling sad, and you might see that too. But in the younger children, a lot of that's going to come out as irritability, because it's just we're not understanding what's happening. They aren't understanding what's happening. So you might see that as anger and irritability. And that can be signs of depression or anxiety or stress. Unable to process consequences. So, maybe you have a system in place with the youth with whom you're working, or in your home, and you know that if this happens, then this is the consequence. And all of a sudden you see that that's kind of not connecting for them anymore. And then you're feeling frustrated. Maybe you feel like I see a lot of people feel like then this is a sign of disrespect. It's not necessarily disrespect. We're just unable to process at that point how this is connected to this. And highly stressed, talked about thinking from an emotional platform and seeming irrational. So that can be those, kind of one thing sort of sets somebody off. Struggling with memory and focusing. If you're working with kids who are in school or who are struggling in school, obviously this is going to be a big problem that can even snowball into other struggles. And they can't process sequentially, which ties into that consequence. I don't understand that if then. Stickers aren't going to do the trick, right? Only just living in that moment, not having the connection to the behavior of the past, not having connection to the potential consequences in the future. Becoming stressed or agitated with traditional discipline techniques. And controlled by a lower brain with a bottom-up control system intact. So our brains develop from the bottom up and the inside out. That survival center is one of the first to develop. And so you might see more of a reaction from more of that emotional reaction, rather than that up here saying, okay, I understand what happened. I can make those connections. I've got that all tied together. So in addition to just looking for signs of maybe unhealthy brain or a shift in behavior, we want to look for signs of emotional suffering that are going to indicate to us that there might be need for intervention or additional support to see if there is mental illness issue here. Now, today we're not talking about diagnosing, right? It's not our most of our jobs to diagnose, but we want to be able to assess. We want to be able to look at these kids that we're working with and notice early, if possible, that there have been some changes and that it might be time to take some steps to intervene and support them, so we don't have that 8 to 10 year gap between onset of symptoms and start of services. So this, from the campaign to change direction, part of their goal is just simplifying what we're looking for. Because, here I am going through all of these things and all of these signs and what's happening in the brain. And it's the quickest overview and just the most basic, not in-depth look. But that's a lot to carry around with us when we are living our own lives and doing our jobs and interacting with our kids at home and at school and at work. So the campaign to change direction is trying to simplify it by saying, here's just 5 things that I want you to look for. And when you start to notice these things, we're going to start working on emotional healthy habits and how we'll get to that in a minute. So we're looking for a change in personality. Any kind of, it could be withdrawal, which we're going to see over here, but that withdrawal from friends. It can be not enjoying things that kids maybe once enjoyed. It can be maybe all of a sudden taking part in risky behaviors that you hadn't seen before, or becoming more aggressive or becoming more tearful. Any kind of personality change, something that's outside of their normal behaviors. And there's that increase in agitation again, right? Anytime we see that irritability, maybe it doesn't make sense to us, we want to look for that and maybe start offering support in a different way. Withdraw from friends, withdraw from school. It can be avoidance, right? Not trying or not completing tasks that they once did, doing everything in their power to not participate in different activities or just different assignments, things like that. Poor self-care. I always get the question kind of for that preteen, teen age. That's kind of just part of that, right? So we want to, we're going to assess that by what we know about the kids that we're working with. Is this a change? Is it something that we aren't able to say, hey, I need you to hop in the shower. I need you to take care of yourself in this way and that way. And then feelings of hopelessness. And feelings of hopelessness doesn't just mean saying I feel hopeless, right? It can be like, I don't feel like anybody likes me. I feel like I'm a burden. I feel like I don't have friends. All of those things we might perk up when we hear those and see those as feelings of hopelessness. Okay, so that was a lot of real fast overview of kind of signs and symptoms to look for, an understanding of what's happening in the brain, which I hope I'm going to connect for you in a minute about why that's important. Okay, so let's talk strategies. This is where it gets exciting, right? So part of the reason I go through very briefly, and probably not as smoothly as someone else might, but through that stress response is because I want us to understand that moving from that gas pedal to that brake pedal is going to happen more smoothly, and it's going to happen faster when, one, we can recognize that we're in a stress state, or when we can help our students or our kids recognize when they're in that state. And 2, that we know we have the tools, we have the strategies to then move, hit the brakes. And the fastest way to do that, well, there's a number of ways to do that. The fastest way is through breath. We started with that deep breath at the beginning. So I want us to be thinking about those things as we go through here. Now, I don't know about you or any student you've worked with, or even just you at home. If somebody I don't know says to me, or somebody I don't have a relationship with maybe says to me, calm down or take a deep breath, there's 0% chance that's going to work. I'm just probably going to be more irritated. I'm not going to engage with that as a productive suggestion. So the most important thing we can do with any child in our life, or any person, honestly, is to create positive relationships. And that starts with psychological safety. And what do I mean by psychological safety? I mean building a space where it's okay to be themselves without apology. So it's okay to make mistakes. It's okay to not be in a good mood all the time. Sometimes we forget that kids are people, especially little kids. And I'm certainly guilty of that myself, kind of wondering why a little 2-year-old or a little 3-year-old or even an infant is acting irritable. We forget that they have bad days too. So we want to give them the space to have those, give them the space to talk about it, to feel comfortable, to come to us with any questions or uncertainty. I know that they're going to be supported. So how do we create psychological safety, specifically when there is uncertainty amidst everything, right? So if we have students moving from different home environments, or maybe there's been a change in the home or a change in the school, or just any kind of difficult time, routine is just the great way to start. And this doesn't mean like a structured schedule. I'll give an example from my own life. When we first went to lockdown and e-learning and all of that in March of 2020, I know this stuff from my work as a school social worker, from my work as a therapist. I'm like, we need to get routine. Well, I went kind of too far the other way. And I like day one, I've got this huge calendar up for my kids. It's like at 9:00, we do this. At 9:15, I had gone too far. I'd overcorrected. But once we kind of worked with that and had a routine of, okay, we're going to get up in the morning. We're going to, we did some deep breaths. We did some morning exercise. We're going to do math, maybe take a snack break, play outside. So it's just a routine, just so there's predictability. The brain craves predictability and can start to calm and feel safe when it knows what's going to happen next in this safe space, right? So routine. I'm sure we see that in our own lives too. I don't know about you guys, but I always do better with routine. Having a designated calm down space. Dr. Lori Desautel is amazing, phenomenal. And she does applied educational neuroscience. She works for Butler University. I'm sure you have heard of her and seen her and know her work. If you don't, check her out. I'll send you the name at the end. But one of the first things I learned from her, watching her speak and listening to her talk, was she called them amygdala first aid station, right? She said, if you get hurt, if your body gets hurt, we know what to do. We send you to the nurse and you get your Band-Aid and you get fixed up, right? So what are we doing for the brain when we have a hurt brain, when we have a stressed brain? A lot of times what we're doing is punishing. And rather than do that, let's have an amygdala first aid station. Let's have a space where we can go and heal and calm. So this designated calm down space, you see the picture there, that's actually from one in our house. And it's kind of funny because you see, we've got the singing bowl, we've got some candles and the wand that it's got the glitter in it. You can find the little objects in there. We've got some journals and pillows and a comfy spot. So that was one that we created together and rather strategically. But what has happened in my own house and what I've seen happen in my office is at school, is that that's all fine and good, but the kids end up making their own. So it doesn't have to be anything formal or fancy. It could be a blanket and a pillow and a coloring book in a corner somewhere that the child understands is a space. And we want to train, and we want to teach them, this is what this space is for, and this is how we use it. So we want to teach and train when they're calm. And then we want to, help guide and give cues to go there. Okay. Let's see what we have. Oh, my clicker stopped. There we go. And when we have that space and when we have these routines, we're going to start to notice patterns of times that might be more difficult during the day, right? And we can schedule preventative regulatory breaks for ourselves and for our children. So if we notice that, that Joey starts to get irritable, maybe mid-morning, then let's say at 9:30, we're going to ask Joey to go on over to his amygdala first aid station, his calm down space, and write a note or color a picture or do some exercise, whatever it is that works, right? We're going to work with him to see what works best for him. And we're going to try to teach our students, teach our kids to get to that space before we're in high need, before we're in distress. And so with that, we're going to do regular well checks. And this can just be as simple as in the morning, how we feeling today? Asking if we have a regular meal together, or if you have a time that you see them in the hallway, or a time that they come into your office, making sure that we're taking a minute just to check in before we get right down to business. We're guilty of that as a society, I think, just jumping into things. I did it today. Usually when I start these presentations, I take a moment and I do a check-in. How are we feeling? I kind of gauge everybody's mood and where we are in this space. And we want to make sure that we're being deliberate and checking in. And then we want to have access to those numbers to call if physically or emotionally unsafe. So we want to know what services we have around us. I'm going to make a note for myself, so I don't think I put them in here. There's a few hotlines we can call, specifically if there's suicidal ideation or worry about self-harm. We want to make sure that we have those numbers handy to call right away, and that our families have those numbers. So if we're working with families or working with students that are having some distress, we want to be able to make sure that there's somebody in the home that has access to these numbers, to these agencies that are going to be able to help intervene in case of an emergency, and or if we feel like it's time that we need to get in for maybe some assessment. And then we want to integrate positive mindset practices to aid in brain health. And so what do I mean by that? Our brains are wired to protect us. It is a good thing. And that's why we have the stress response system. That's why we can respond like that. And we like that. That's good. But what that means is we're wired to seek the negative. And so when we are in a state of chronic stress, we're just seeking negative over and over to protect ourselves. And as long as there is no actual physical threat, we can start to retrain the brain to seek positive as well. And so I'm not talking about, maybe toxic positivity, but just reminding our brain that there's a lot of positive to seek out as well. So Dr. Daniel Amen wrote many books. He's a psychiatrist who his practice is built on the idea that psychiatrists are the only doctors who aren't looking at the organ that they're treating, right? So if you go to a cardiologist, they're going to look at your heart before they make a diagnosis, before they make a treatment plan. They're going to look at your heart and they're going to see what's going on, and they're going to make something individualized for you. Dr. Amen is saying, historically in psychiatry, we listen to symptoms and behaviors, and then we make an assessment. And why aren't we looking at the brain? So he has developed a system in which he's looking at brain scans and making treatment plans based on those brain scans. And I think I'm going to get the number wrong. I think it might be 8, something like that, 8, maybe more different types of ADHD. He said, we're just saying, hey, you have ADHD, and we're treating it, maybe with medication, maybe with some therapy, or some skill building. But when you really look at the brain, there are a number of different ways that can be impacting your brain. And so there's a number of different strategies for treatment. And so one of the things, so this ending mental illness, he goes through and he talks about these strategies that we can do to just encourage brain health in general, that's going to support mental wellness. It can be preventative in terms of mental illness down the line, or it can be intervention as well if we're already suffering. So kind of went off on a tangent there, but his work is amazing. And this is one of my favorite things. He wants to keep it simple. He wants you to be able to integrate it into your daily life. We're not trying to add new, curriculums or hour-long activities for everybody every day. So he has us do these things to help seek the positive in our world. And the first one is just to say, today's going to be a great day every morning. So you get up and you just say to yourself, today's going to be a great day. And it sounds ridiculous. I do it. I do it with my kids. I do it with my kids at work. I do it with my kids at home. And it's funny, kids are so much better than we are. And so my own children have kind of kept it going. We started this routine. We say, today's going to be a great day. You don't always believe it, right? It doesn't always feel right, but we say it. And so now, especially during the school year, you get into these routines, and my kids go get on the bus and they say, bye, I love you. Today is going to be a great day. So it just is starting to train that brain to look for the positive. And then we want to write down at the end of the day, specifically, 3 things that you're grateful for, and then what went well. So at the beginning of the day, we're starting off by saying today is going to be a great day. And at the end of the day, we're saying, okay, maybe it was, maybe it wasn't, but here's some pieces of gratitude I can find. And here's what did go well today. So we do that at the end of the school day. What went well today, and just kind of shout out. And then in my own home, we do it at the dinner table. So not necessarily at the end of the day, you can do it at bedtime, or but at the dinner table, we go around and say what went well today, or we do rose, thorn, and bud, right? What was your rose? What was your thorn? What was your bud? So those are some different ways we can start to train the brain. And these are going to be incredibly helpful for our kiddos who are seeking strategies to find the positive. And that's going to help you build relationships with these kids, and they're going to feel safer in your presence to be able to share these things. And then we want to create connection. We know that the brain craves predictability, and it is wired for connection. And without those things, we have some struggles. I'm going to just check, because I think I'm missing a quote. I want to see if I have it real quick. Okay, so I talked about Dr. Lori Desautel earlier, and I wanted to share this. One of the things that she shared sometime along in the past year or so is that 3 conditions that are difficult for our brains to withstand are chronic unpredictability, isolation, and physical and emotional restraint. So we were experiencing all of those. Our kids were experiencing all of those during the past year. And what we can do to start to heal, or start to bring our brains kind of back online and back to an engaged space, is start with connection, and then with recognizing and naming emotions, which we're going to get to next. So I'm sure you're creating connection in all of your work, right? That's probably, if this is your field, it is your job. Let's talk about some ways that we do that. Creating communities. So it can be incredibly helpful to have a space and a place to talk with people who are experiencing what you're experiencing, right? That can be healing. In the medical field, I can picture him, Dr. Mark Hyman. He had done a study where he's a functional medicine doctor, and he was treating different medical disorders. I think diabetes was the one that he used as an example for this. High blood pressure was another one. And he just wasn't able to see as many clients as he wanted to, or as needed the help. So through the hospital, with the hospital he was working in, they started a treatment plan that included communities. So if you all had a shared diagnosis, you would get together regularly with these people, and you would see the doctor less. But you had this community of support to get you through whatever the treatment plan was, or just, the ins and outs of going through what you're going through. That feels unique to you and can be isolating at times. And what he found was the patients that he had that went through that treatment plan, that had the communities, were healing significantly faster than the patients that had the same doctor, same treatment plan, but didn't have the community. And that's true for our brain health as well. It's incredibly true for our adolescents who need that peer-to-peer support. So finding and helping create communities where they can feel seen and heard and supported is going to be incredibly important. The 2x10. This is an evidence-based relationship building strategy that I love and have seen work incredibly well, again, especially in school settings. So what this is finding a student or a client that you are having a hard time maybe connecting with, or maybe you want to build a better relationship with, maybe they're struggling, and you take 2 minutes a day for 10 consecutive days or 10 consecutive meeting times. And you just pull that kid aside and you let them lead the discussion, talk about whatever they want to talk about for 2 minutes. And then and then move on. And I have seen this do incredible things. I worked with a young boy. He came to me when he was in third grade. I saw him every day in third grade. I saw him 3 days a week, I think in fourth grade. And in fifth grade, we weren't seeing the progress that we'd hoped to see. He had a team of professionals that would come into the school, and we would have these meetings and we would make these plans. And he was having a real hard time. He and his teacher were having a really hard time connecting in fifth grade. And the teacher decided to try that 2x10. And after that, those 2 school weeks after that, there's a complete change in behavior. There was a complete change in, he started turning his homework in. He went from being like the kid in class that was calling the teacher out. He's kind of mean to her sometimes. He told her he wished her baby would get sick, and he just, wasn't very nice to her. And after that 10 days, he was just her biggest champion. If the class was getting loud, he was like, hey, Mrs. S asked us to be quiet. And it continued. The healing just continued from that point. That was the beginning of fifth grade. And at the end of fifth grade, I was seeing him once a week, and that was just for check-ins. And because I wanted to, his team of professionals, behavioral health professionals, they were talking to the teacher, they're talking to me, they're saying, what happened? What was the difference? And that's what started it. That's where it all started, was by giving him the space, 2 minutes a day, to just connect and talk about himself, not about school, not about anything that we were pushing on him, just letting him have that space. And that's probably the most powerful story that comes to mind, but I've seen lots of them. And then there's 5 to 1. I don't know if you've heard of this ratio. That is just being mindful of how we are interacting with the kids in our life. And that's just 5 positives to 1 negative. So if you have a student that you find are often correcting or guiding to go a different way, it might be perceived as a negative, right? Then we want to make sure that we have 5 positives to that 1 correction, to that 1 negative. So I've seen people use pennies or beads and move 2 pockets to make sure they're getting those 5, maybe in an hour, or that 5. A few years ago, I was presenting with a couple coworkers, and we were traveling, and so I hadn't been around much at home, and we were talking about the 5 to 1 and at these sessions. And I came home, and my daughter, gosh, I think she might have been in 2nd grade at the time. I sat down with her at bed, and I was kind of going through things with her, and she burst into tears, and she said, you've only said, she didn't say negative, but you've only pointed out things I've done wrong this week. And I said, oh no. And I'd gotten in this mentality of fix it, where I was here and I was there, and I was coming back, and I was like, you need to do this, you need to do that, you need to do that. And it was a real wake up call, I guess, that I needed to practice what I was teaching and do it in a mindful way. So that's a good one to think of. 5 to 1, 5 positives to 1 negative, or 5 encouragements to 1 correction. John Gottman says that in marriages, in relationships, it should be 10 to 1. So if you want to practice that at home, or not, it's up to you. And another way to create connection, especially if you have a student or a kid who is struggling to open up, or maybe feels uncomfortable, is their mom and me journals, or have a grown up and this child that has a shared journal, and so they can write things in their journal at any time. And there's no punishment for what's in the journal. It's just a shared documentation. They write something in the journal, and when they want you to see it, then they have a place where they put it. It could be under your pillow, it could be in your nightstand drawer. If it's in your office, maybe you're in an office building, if they want to write something, maybe they set it on your desk. And then when the student isn't there, or if they want, you can have that conversation. Do you want me to read it now? Do you want me to wait? And then you can respond in the journal and then put it back. And sometimes that's just an easier way for the kiddos who are having a harder time verbalizing what's happening with them. It can be written exchange. It can be drawings. And I'm going to forget the name of the book, but I was listening to a Brene Brown podcast with an author of, imagine some kind of wellness book. And she was saying that when she was in school, she had a teacher who they would all write in journals. the whole class had a journaling time, and then they would give it to the teacher. And she said that was when she first learned that it was okay to express herself. And it was the only safe space she had to talk about what was happening with her, with what was going on in her home. There was a lot of disruption and change in her home at that time. And she's held, I mean, it shaped her career path. It shaped who she was as a person. It was incredibly impactful. All right, family meetings. I say family meetings, but it just means it can be small group meetings. It can be classroom meetings. It can be you and just the student with whom you're working. And I'm going to find these questions here to make sure I get them right. But a family meeting is simply sitting down once a week, once a month, or whatever you decide, and asking 3 specific questions and creating a plan based on those. So we're going to sit down and we're going to say, hey, what's going well? What's going well in our classroom? What's going well at home? What's going well with whatever it is, whatever your shared space is? What's going well with us? And then we're going to say, what can we improve? And then finally, what is our plan? And what we're doing here is, one, we're validating their feelings. We're asking for their input, and we're empowering them to assess and share their feelings, and then empowering them to create a plan to move forward. So an example of that might be, when I'll give you another pandemic example. When we had to all of a sudden do school and work all in the same space, we said, what is going well? Well, we're getting our work done, kind of. We're making it, sort of. I think that was as far as we could go with what's going well. All right, what needs to be improved? Well, we each need space and time to get specific things done. So how do we do that? What's our plan? So we had to make schedules. We had to sit down and decide how that was all going to work. So that's just a shared example from home. In classrooms, it can be the same kind of thing. What's going well? What needs to be improved upon? And how do we work together to make that happen? And the most important thing we can do, in my opinion, in terms of creating connection is validating. Validate. So often, and not intentionally, we invalidate kids' feelings, right? They come to us and they say something like, oh, I don't have any friends. Oh, yes, you do. You have so many friends. Well, we think maybe we're trying to just be supportive and point out that, yes, you do, but we're invalidating the way that they feel. And we just can change that with just quick little language adjustments. So they come to you and say, I don't have any friends. Oh, it must be really hard to feel that way. I wonder if we could write down some people that are your friends and see if we could help you feel a little bit better about that. Things like that. Validation works. I mean, we all want to be seen and heard, right? And when we know somebody's going to see us and hear us and not always try to fix us, then we're going to have that shared connection, and we're going to feel safe. We're going to heal. So validate and normalize feelings. It's okay to feel sad. It's okay to feel angry. Now what? Now what do we do? Just validating before we help. And with that, we have to be able to name our emotions. It's always going to start with our sensations. So sensations are the first things, and we talk about that 3 to 5. Sensations are where they're going to notice things first. They aren't going to be able to come to you and maybe say, I'm feeling really left out. I'm feeling lonely. I'm feeling angry. They might just say, like, I feel tightness in my chest. If you kind of ask what's going on in your body, I feel like I need to run. I feel butterflies in my stomach. I have a headache. What are the sensations that you're feeling? And then we're going to say, what are those sensations telling you? What information is that giving you? And then we're going to get to feelings. That's going to be the third thing. So another thing Dr. Lori suggests is having, we have feelings walls or feelings words. What if we just start with sensations? Just start simple. Start by naming sensations. So maybe there's a jar with a bunch of sensations in it. Butterflies in stomach, tightness in throat, hot, cold, sick, any kind of tired, any kind of sensations. And so if a child is having a hard time, they might go and they pick out the words that make sense to them. Here are my sensations. And then the next step, we're going to get through, what's that telling you? I'm going to get through these so I can show you the graphic. All right, so Permission to Feel is a fabulous book if you have time in your summer reading list or whatever might be going on, I highly recommend this book and by Mark Brackett. And then he uses what's called the ruler method to help identify feelings. And we're going to start with that, with sensations, recognizing. So we're going to pause during the day and we're just going to take note. Where are we right now? So that's something we can give to our kids. We can pause and say, hey, I just want everybody to take a moment, check. You can do a body scan, close your eyes, go through your body one by one, notice what's in your head, your chest, your arms. Then they can color it, they can write it out, things like that. But we know that we can't tame what we can't name. So if we can't identify what's going on, we aren't going to be able to start healing. And if we empower our kids at a young age to start to recognize these things, then that's the very first step in having the skills to regulate. And so we want to give them the tools to recognize these emotions. So you kind of look at this for a minute. We're going to recognize what's going on. We're going to understand it, label it, and then express it, right? We're not trying to push it down. Say, okay, I need to express it. Do I need to write it down? Do I need to say it out loud to somebody? What do I need to do? And then we're going to regulate. Is that a deep breath? Is that exercise? Is that going to get a drink of water? What do we need? Okay. And as we teach them to recognize their emotions, then we're setting them up to be able to say, aha, that's what's going on. Now I'm going to move to this next step of regulating my emotions. The greatest thing in terms of regulation where I've seen success is teaching students how the brain works, giving them those words to say, you are in your amygdala. I had a fourth grade student who on the ACEs, I think she had 9 out of 10. She had a tough time. She was aggressive. She eloped often. She was verbally aggressive, physically aggressive. And she and I started with just talking about what's going on in the brain. And what I was hoping to do was tell her that so often kids are getting the information or getting the message that they're bad kids, right? That you don't have any control. You're making these choices. And that's not that's not what's happening. And two, that's not the message we want them to receive. So I'm talking to her about what's going on in your brain. You're having a survival reaction. And we're going to talk about how we can do that in a safe way. So here's what's going on in your brain. Your guard dog is going off all the time and we need to get you up to your wise owl. So how do we do that? We're going to do that through recognizing when we're stressed. And then we're going to take some deep breaths. We're going to walk away to our safe space with permission if that's something that works for you. So she and I went through this for months and months. And one day I hear her leaving the gymnasium screaming. You recognize the screams of your clients separate, right? And I took my deep breath, regulated myself, went out to meet her, and her eyes were glazed over. I said, "Honey, what's going on?" And she said, "Mrs. Krieger, I'm in my amygdala." And I was like, "Yes, you are. 100% you are." And she was going to her safe space. And that was just the start of healing for her, and control. She had some control, and that's incredibly important. Emotions are data points. They're just telling us that our body needs something. So we don't want to shame them. They're innocent. I have another student who, when she gets nervous, she walks into a setting and she'll say, it's okay to be nervous. And then she takes a deep breath and she moves on to her thing. And I love that. So we want to teach and model these coping skills. It could be breath. It could be yoga. I'm going to go through them right here. I see that I'm almost out of time. We're almost done. So here are some of the coping skills that we can teach and we can model. We want to integrate these into our days, into our practice, so that we're teaching them when we're calm, when the student is calm, and we're asking them. The reflection piece is key. So I'm going to have you journal, and I'm going to say, how do you feel after you wrote that down? Do you feel better? You feel worse? How do you feel? Mindfulness is just bringing yourself to the present moment. It can be focusing on breath. It can be going for a walk and just focusing on your feet as they walk. It can be eating a raisin really slowly or a piece of chocolate. Yoga, dance, exercise. We know that movement and breath are the fastest ways to move from that, or to hit that brake pedal, so to speak. Get creative. Harry Fisher maybe said, take that. I'm going to get it wrong. I can't remember, but take that pain and turn it into art. She had a catchy way of saying it. Like all these things we can practice. And as we practice them, it can just be once a week for a couple of minutes. We're going to draw and tell me how you feel. What we're doing is we're building a toolkit so that when we are in distress, we're going to say, you know what I noticed helped you was drawing. Let's do that for a minute. And giving them the opportunity to check in and say, here's where I am. Here's where I need to be. And deep breath. It's always going to be my favorite. It's simple. It's free. There's so many ways you can do it. Look, if you have Go Noodle, you can do it that way. You can just look it up. Rainbow breathing is a good one for the little ones. They make rainbows, all kinds of great ways to practice that breath. And with breath, you only need 90 seconds. So that's how quick it can be. 90 seconds of deep breathing can start to change the brain. And the more you practice it, the more you're increasing what's called your vagal tone, which means that as you continue to practice it, the shift is going to be faster from stress to rest down the line. And then finally, my last little note is for all of you and me, that we cannot forget to take care of ourselves. It is so easy to do. But like I said, a dysregulated adult cannot regulate a dysregulated child, right? Bruce Perry, Dr. Dessa tells us, we hear that over and over, that we have to be working on ourselves. We can't give to the kids what we can't give to ourselves. Mental hygiene is just as important as washing your hands. So extend yourself grace, lower your expectations if you need to without guilt. Be kind to yourself. Treat yourself like you treat your friends. Prioritize your physical and mental wellness. And that can be as simple as breathing every day. Oops. And then building in those brain healing strategies for you. So I gave a lot of information. It's 11:59. I hope it was helpful. What are your questions?
Thank you so much, Tiffany. So we did get one question that was sent to me. So let's see. Okay. So taking from personal experience as a mom of 3 young kids who also has been diagnosed recently with general anxiety disorder, I am becoming more familiar with mental health issues. I have learned there may be a genetic link. I worry that my 6-year-old may also have anxiety as well. Sometimes it feels like the blind leading the blind. How can I best parent my child with anxious tendencies? Most of her anxious behaviors are expressed through agitation and anger with difficulty with transitions.
Great question. I too, general anxiety and depression. I've had depression since I was 10 years old. And it's why I went down this road, I think, and down this career. And my younger daughter also has a lot of anxiety, and it was she's almost 7 now. When she was probably 3 or 4, it was agitation as well. So I share that to say, I see you. I've been there. And here's what I have seen work personally and with clients. One is there have been a lot of times where I've doubted myself because we just kind of let the agitation go. Like we get them safe, right? Because I can't do anything when they're in that agitated state to necessarily calm, except just be there. So I've been in situations where she used to throw things a lot. So we would sit in her room and she would throw, and I would say, I want to help you. I'll help you when you're calm. I'll know you're calm when your voice sounds like mine, and say that over and over. Okay. That comes from parenting with love and logic, but just staying the calm and staying beside them in that space. And when they are calm, then I would sit with her and I would say, what do we do? What helps us? And she would say, we'd been practicing deep breathing as part of our regular day. So we know, okay, deep breath helps us. So let's do that together now. And it's a lot of meeting them where they are and modeling. I say all the time, I'm feeling very stressed. I'm feeling very nervous. I know that I need to take a deep breath and I need to walk away. And I do that regularly, and it feels vulnerable and it feels, it doesn't feel good sometimes, but I try to model it. And then when I see her in that space, she'll start to mimic me, and your daughter will too. And I know you're giving her the tools just by recognizing that she has these struggles. And the very exciting thing, I think, is that by starting these strategies when the kiddos are young, is that they'll go to them automatically as they get older. So you're already starting that process in her brain where she's going to start to recognize, okay, this is how I'm feeling the agitation. And then it's going to become more automatic for her to take a deep breath or to walk away or to know what her body needs. I don't know if that completely answers the question, but I think just sitting with them, keeping them safe, and then modeling over and over, it can be incredibly healing.
Thanks, Tiffany. So who do we go to when we feel we need help? My husband and I both have mental health issues. We try deep breaths and my 4-year-old daughter screams in my face, no deep breaths.
Yeah.
She has extreme anger and had been kicked out of school, out of Sunday school and vacation Bible school. We've tried all these things you've mentioned, and now I'm seeing it in my 2-year-old.
Yeah. First of all, you're doing a great job. You are. Keep doing the things that I'm talking about. 4 and 2, they're so little, and it takes a lot of time. Who can you go to? If you look at, I'm going to write it down too so I can send it. American's APA, what is that? American Psychology Association. They have a great therapist matching tool on their website if therapy is the way you want to go. I don't know if your 4-year-old is in preschool or not, but schools have been extremely helpful for me, for my kids, for the kids that I work with, and connecting with, sometimes they have services on site, which can be very helpful. Also, you should have a community mental health agency in whatever your county is. You can look up CMHA, Community Mental Health Association, and it is sometimes hard to get in, both in preschool. I would start there and I would just go in and I would say, this is the support I need. What are your connections? And keep doing what you're doing. Keep advocating for your child. I know that's what you're doing. The no deep breaths, I get that. I feel that way sometimes too. My biggest suggestion with that is, one, it takes so much time. All of this takes so much time. And so just know that you're doing the right things. And 2, just to find ways to practice it when they're calm. Because like I kind of said earlier, if somebody tells me to take a deep breath, I'm 40 years old. Somebody takes me to take a deep breath, I sometimes have that reaction too, right? And also, I don't have it in front of me. I have a glitter jar, and like those calm down jars. And I talk with kids as young as 3 about the brain. And I say, when it's all calm and all the glitter's at the bottom of the jar, I say, look at this. Let's pretend this is your brain. It's your brain right now. We're playing. You're excited. You have all this room to learn. And this is a clear brain, ready to learn, ready to play. But you know what happens sometimes? Sometimes when I'm playing outside and my sister kicks me, my brain kind of gets rattled, or maybe I go through the things that happen. I don't get the snack I want. Something happens at school and I get all these things swirling around in my brain. And I look in there, I see angry and I see sad and I see mad. And now there's no room to do any of the calm stuff. And that doesn't feel good. That feels yucky, doesn't it? So what do I do with this jar? Do I keep shaking it? And they're gonna be like, no, put it down, right? And you talk through and say, yeah. And so I'm gonna take my jar and I'm gonna go, and I'm going to set it down and I'm going to breathe until all those feelings fall to the bottom. And they aren't going to go away because we have feelings and they're in there, but they're going to be at the bottom so that we're ready to learn and we're ready to play. And that was kind of a long version, but I start with that calm down jar. And I started it with kids 3. Your 2-year-old's going to watch your 4-year-old, but I started with kids as young as 3, where and then every day we shake that jar. What's happening in the jar now? What do we do to settle it? That's right. We take and just hang in there. I know it's hard. All of this is really hard.
And thank you all so much for being here. Have a great rest of your Tuesday, and we will see you all in a future workshop or presentation.
Yes,
thank you so much, Tiffany. Thank you.
Thank you.
Yes, thank you.
Thank you.